Aspirin, also known as Ecpirin, is commonly used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It can also help reduce pain and swelling in conditions like arthritis. Ecpirin is a type of nonsteroidal anti-inflammatory drug, NSAID, that works by blocking certain natural substances in the body to reduce pain and swelling. It can also be prescribed by a doctor to prevent blood clots, reducing the risk of stroke and heart attack. If you have recently had surgery on clogged arteries, your doctor may direct you to use Ecpirin in low doses as a blood thinner to prevent blood clots. It's important to consult your doctor before giving Ecpirin to a child younger than 12 years old. The recommended daily dosage and the best time to take Ecpirin will depend on your specific medical condition, so make sure to follow your doctor's instructions. If you are taking this medication for self-treatment, make sure to follow all the directions on the product package. Always consult your doctor or pharmacist if you have any questions. Take this medication by mouth with a full glass of water, unless instructed otherwise. Avoid lying down for at least 10 minutes after taking the medication, and if you experience any stomach upset, you can take it with food or milk. Make sure to swallow enteric-coated tablets whole and do not crush or chew them. The same goes for extended-release tablets or capsules, do not crush or chew them unless advised by your doctor or pharmacist. The dosage and length of treatment depend on your medical condition, so it's important to read the product label for recommendations on how many tablets to take in a 24-hour period and how long to self-treat before seeking medical advice. If you are using this medication for self-treatment of headache, seek medical help immediately if you experience trouble speaking, weakness on one side of the body, or sudden vision changes. Also, consult a doctor or pharmacist if you have headaches caused by head injury, coughing, or bending, or if you have a headache with vomiting that is severe or doesn't stop, fever, and stiff neck. Remember that pain medications work best if used at the first signs of pain, and you should not use this medication for self-treatment of pain for longer than 10 days. If your condition lasts or gets worse, or if you think you may have a serious medical problem, tell your doctor promptly. If you experience upset stomach or heartburn while taking Ecpirin, it's important to inform your doctor or pharmacist. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects, but it's crucial to seek medical attention if you have severe or persistent nausea/vomiting, easy bruising/bleeding, difficulty hearing, ringing in the ears, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing of the eyes/skin. While rare, Ecpirin may cause serious bleeding from the stomach, intestines, or other areas of the body. Seek immediate medical help if you experience severe or persistent stomach/abdominal pain, black/tarry stools, vomit that resembles coffee grounds, trouble speaking, weakness on one side of the body, sudden vision changes, or a severe headache. Additionally, if you notice symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or difficulty breathing, seek medical help right away. It's important to note that this is not a complete list of potential side effects, so if you experience any other effects, it's best to contact your doctor or pharmacist for further guidance. If you are in the US, you can also report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking aspirin, it's important to let your doctor or pharmacist know if you have any allergies, as this product may contain inactive ingredients that can cause allergic reactions. It's also crucial to consult your doctor or pharmacist if you have certain health problems such as bleeding disorders, kidney or liver disease, stomach issues, asthma, nasal polyps, gout, or enzyme deficiencies. This medication may cause stomach bleeding, especially when combined with daily use of alcohol and tobacco. Therefore, it's advised to limit alcoholic beverages and stop smoking. Also, it's important to inform your doctor or dentist about all the products you use before having surgery. Children and teenagers under 18 years old should not take aspirin if they have certain illnesses or have recently received a vaccine due to the risk of Reye's syndrome. Elderly individuals may be more sensitive to the side effects of this drug. Aspirin is not recommended for use to treat pain or fever during pregnancy, especially during the second half of the pregnancy. It is important for women of childbearing age to discuss the benefits and risks with their doctor before using this medication. Aspirin can also pass into breast milk, so it's important to consult your doctor before breastfeeding while using this drug. Drug interactions can affect how medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Ecpirin include mifepristone, acetazolamide, blood thinners such as warfarin and heparin, corticosteroids like prednisone, and herbal medications like ginkgo biloba. Before using Ecpirin, talk to your doctor if you have recently received certain live vaccines. Also, be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers or fever reducers known as NSAIDs. To prevent an overdose of aspirin, read labels carefully before taking other pain relievers or cold products to make sure they do not contain aspirin. Daily use of NSAIDs like ibuprofen may decrease aspirin's ability to prevent heart attack or stroke. If you are taking low-dose aspirin for prevention, consult your doctor or pharmacist for more details and to discuss other possible treatments for your pain or fever. It's also important to note that Ecpirin may interfere with certain lab tests, causing false results. Be sure to inform lab personnel and all your doctors that you are using this medication. If you suspect an overdose or notice serious symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Symptoms of overdose can include burning pain in the throat or stomach, confusion, mood changes, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, and loss of consciousness. Always seek medical assistance if you suspect an overdose. If you are taking Ecpirin regularly or in high doses, your doctor may want to conduct lab tests to monitor your liver and kidney function, blood count, and salicylate level. It's important to keep all medical and lab appointments and consult your doctor for more details. There are various forms of Ecpirin available, some with special coatings and some that are long-acting. It's best to ask your doctor or pharmacist for their recommendation on the best product for you. If your doctor has prescribed Ecpirin for you to take regularly, make sure you take it at the same time every day. If you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed one and take the next dose as scheduled. It's important not to take a double dose to make up for the missed one. As always, it's best to follow your doctor's instructions on how and when to take your medication. When storing Ecpirin, it's important to keep it at room temperature and away from moisture and light. Different brands may have specific storage requirements, so be sure to check the product package or ask your pharmacist for instructions. Avoid storing it in the bathroom and do not use any Ecpirin product that has a strong vinegar-like smell. Keep all medications out of reach of children and pets. When it comes to disposing of Ecpirin, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, always follow the proper disposal guidelines to ensure the safety of the environment and those around you. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.